Are you struggling with chronic kidney disease or have any other kidney issues? Did you know that the first few hours of your day can make or break your kidney health? That's right. How you start your morning has a huge impact on how well your kidneys function throughout the day. But don't worry, we've got you covered. In today's video, we're sharing the top 8 morning habits for kidney patients that can truly make a difference in your kidney health. From simple hydration tips to mindful routines and dietary choices, these habits are designed to help you start your day the right way and support your kidneys for the long haul. So, without further delay, let's dive right in, starting with something incredibly simple but surprisingly powerful. What's the first thing you do when you wake up? Before checking your phone, making coffee, or doing anything else, start your day with a glass of lukewarm water. Now, you might be thinking, really? A glass of water? The answer is a resounding yes. Here's why. After 6 to 8 hours of sleep, your body is naturally in a mild state of dehydration. You haven't had any fluids overnight, and yet, during that time, your organs, including your kidneys, continue performing their vital functions. So, that first glass of water in the morning helps rehydrate your body and gives your kidneys the signal to keep functioning efficiently. But why does hydration matter so much for your kidneys? Well, hydration is especially important for kidney health because water helps them filter waste, regulate fluid levels, and keep electrolytes in check. When you don't drink enough, these processes slow down, and waste starts to build up. Starting your day with water supports your kidneys right away and helps them function more efficiently throughout the day. Now, why lukewarm water specifically? Well, drinking lukewarm water, not too hot, not too cold, has a few benefits. First, it's gentler on your stomach and absorbs more quickly into your body. Plus, warm water helps improve blood circulation, which boosts kidney function, since your kidneys depend on an efficient blood supply for filtration, and it helps get your entire system activated. But the benefits don't stop at your kidneys. Early hydration can also help prevent constipation, which can place extra pressure on your kidneys. When your digestive system slows down, toxins can accumulate, forcing your kidneys to work harder to eliminate them. By rehydrating first thing in the morning, you're setting your body up for smoother digestion and relieving your kidneys of unnecessary stress. So, how much should you drink? Don't worry, no need to down a large bottle right away. Just 4 to 8 ounces, that's about half to 1 full glass, is enough to gently wake up your system and give your kidneys a healthy start without overdoing it. This amount is especially safe if you're on dialysis or following a fluid-restricted plan. And if you are on a fluid restriction, don't forget, your morning water counts toward your daily total. Most people on fluid limits are advised to stay between 32 to 48 ounces per day, which equals about 4 to 6 standard glasses of fluid. But always go with the exact amount your doctor recommends, since everyone's needs can differ. Now, here's a super helpful tip. You can actually check your hydration status by paying attention to your urine color. Sounds simple, right? But it's actually one of the easiest and most reliable ways to gauge your hydration status. If your urine is a pale yellow, that's a great sign. Your body is hydrated just enough, and your kidneys are working efficiently. But if you notice it's dark yellow, that's a gentle warning that you might be slightly dehydrated and need more fluids throughout the day. If your urine looks amber or brownish, that's more serious. It could be a sign of severe dehydration or even something affecting your liver or kidneys. And what if your urine is totally clear? That might actually mean you're drinking too much water, especially if you're on fluid restrictions. It's a delicate balance. But here's the one to never ignore. If your urine looks red, pink, or like cola, that could indicate blood in the urine, and you should contact your healthcare provider immediately. So, with just 1 glass of lukewarm water in the morning, you're not just quenching your thirst, you're reactivating your kidneys, supporting digestion, and giving your body a clean start to the day. Now that we've talked about hydration, don't just sit there. Get up and stretch, or take a short walk. It may seem like a small thing, but trust me, moving your body, even just a little, can make a world of difference for your kidneys. Here's why. When you get your blood flowing with light stretches or a short walk, you're improving circulation. This means your kidneys receive more oxygen and nutrients, which are crucial for their daily functions. Better circulation helps your kidneys filter waste, balance fluids, and maintain overall health more efficiently. Think of it like giving your kidneys an energy boost, helping them perform at their best throughout the day. But the benefits don't stop there. Regular movement also helps you manage things like your weight, blood pressure, and blood sugar, all of which are major factors when it comes to protecting your kidneys. High blood pressure, uncontrolled blood sugar, and extra weight can put extra strain on your kidneys, but just a few minutes of movement can keep these in check and slow down any potential kidney damage. So, how much should you do? No need to go overboard. Start with just 5 to 10 minutes of light walking or gentle stretches. If you're feeling limited in movement, seated leg lifts or slow arm rolls can work just as well. The idea here is to keep things light and easy. Don't feel pressured to do anything intense first thing in the morning. Now, here's an important tip. Avoid jumping into any intense workouts right after waking up, especially if you're feeling weak, dizzy, or not quite yourself. Your body needs a moment to ease into the day. And, while it might be tempting to settle into a comfy chair for too long, try not to stay stagnant for hours. A few minutes of stretching your legs or gently rolling your arms can help keep things moving. And while we're on the subject, keep in mind that heavy exercises, especially if you have kidney issues, can actually be a bit too much. Intense workouts might cause dehydration, which can put even more strain on your kidneys. When you're dehydrated, your kidneys have to work harder to filter waste and maintain balance, which can lead to stress on the organ. Plus, heavy exercises can sometimes cause muscle damage or inflammation, which is harder on your kidneys if they're already compromised. So, it's better to stick with gentle, low-impact movements that are kind to your body and kidneys. So, whether it's a short walk around the block or some easy stretches in the living room, make it part of your morning routine. It's a quick and simple way to get your kidneys, and the rest of you, up and running smoothly for the day ahead. Now that we've covered hydration and movement, let's focus on another important part of your morning routine: your breakfast. You might not realize it, but what you eat in the morning sets the tone for how your kidneys function throughout the day. It's more than just about filling up. It's about giving your kidneys the right nutrients so they can do their job efficiently. But why is a kidney-friendly breakfast so crucial? When you start your day with the right foods, you're helping your kidneys regulate your blood sugar, keep your minerals in check, and maintain balance in your body. Managing blood sugar is key, especially because high blood sugar can lead to kidney damage over time. And let's not forget about the impact of certain minerals. Foods high in phosphorus, potassium, and sodium can put extra strain on your kidneys. That's why it's so important to pick foods that support kidney function without overwhelming them. Okay, so what should you eat to give your kidneys the best start? Let's dive in. Have you ever considered egg whites on white toast for breakfast? It might sound simple, but it's a fantastic choice for kidney health. Egg whites are low in potassium and phosphorus, making them a much better option for your kidneys compared to whole eggs. They provide a great source of protein without overloading your kidneys with too many minerals. Pair them with a slice of white toast, and you've got a meal that's balanced in carbs, protein, and easy on your kidneys. Plus, this combo is super quick to prepare, so you're starting your day without any hassle. But if you're in the mood for something with a little more fiber and antioxidants, low-sodium oatmeal with fresh blueberries is another amazing option. Oatmeal is super gentle on your kidneys and full of soluble fiber, which helps with digestion and supports heart health. Add some fresh blueberries, and you're boosting your meal with antioxidants that help protect your whole body, including kidneys from damage causes by oxidative stress. Plus, blueberries add a sweet touch without spiking your potassium levels, so you get a healthy, kidney-friendly start. But maybe you're not a fan of oatmeal. No worries. Fresh apple slices or grapes are perfect for a lighter breakfast. These fruits are low in potassium and high in fiber, making them ideal for kidney health. Apples, for example, are packed with pectin, a type of fiber that helps manage blood sugar and cholesterol. Grapes, on the other hand, are full of water and antioxidants, which help keep your kidneys hydrated and fight oxidative stress. Together, they make for a refreshing, nutrient-packed start to the day. However, if you are diabetic, keep in mind that the glycemic index of grapes is moderate, meaning they can cause a slight increase in blood sugar levels. It's always a good idea to monitor your portion size and balance them with other foods to avoid blood sugar spikes. Now, if you're someone who enjoys a warm drink in the morning, why not try some herbal tea? Chamomile, ginger, or peppermint teas are all great choices. They're low in potassium, and not only that, they're mild diuretics, which means they help your kidneys flush out waste by encouraging urine production. They're a great way to support your kidneys without causing dehydration. Just make sure to avoid black tea, as it contains more potassium, which might be an issue if you're managing your intake. And while we're talking about foods to enjoy, let's take a moment to think about what you might want to avoid. At first, take bananas and oranges. While they're packed with nutrients, they also come loaded with potassium. For most people, that's not an issue. But for those with kidney concerns, too much potassium can really add up and cause trouble. Then there's bacon and sausage. Super tasty, right? But here's the thing. They're high in sodium and unhealthy fats, which can raise your blood pressure and add extra stress to your kidneys. And don't get me started on processed cheese. It may seem like a harmless snack, but it's packed with sodium and phosphorus, which can cause long-term damage to your kidneys if consumed too often. And those packaged muffins that we all love for a quick breakfast? They might seem like an easy option, but they're also usually loaded with sodium, phosphorus, and unhealthy fats, none of which are doing your kidneys any favors. So, while these foods might taste good at the moment, it's worth thinking twice if you're looking to keep your kidneys in top shape. And remember, the key takeaway here is balance. A kidney-friendly breakfast isn't about being restrictive. It's about making mindful choices that nourish your body and support your kidneys. And with this, you've got the hydration, movement, and breakfast covered. So, what's next? How about setting yourself up for success with another essential habit that might not get enough attention but is absolutely crucial: staying on top of your medications. So, why is taking your medications on time so crucial? Here's the deal. Kidney health is often tied to managing other conditions, things like high blood pressure, phosphorus levels, or even anemia. These are all conditions that can directly affect how well your kidneys function, and the best way to keep them under control is by staying consistent with your medications. When you take your medicines at the same time each day, you maintain stable levels in your bloodstream, which helps manage those conditions without them spiraling out of control. So, a little routine goes a long way. But how do you make sure you're staying on top of your medicines? First, it's all about making it a habit. Whether it's in the morning or before bed, having a routine helps keep you consistent and ensures you're getting the benefits of the medication when your body needs it most. It's also a good idea to take your medication with food or after eating if your doctor recommends it. This can help prevent stomach upset and ensure that your body absorbs the medication properly. And if you have multiple medications, consider keeping them visible in a spot where you'll see them daily, like near your toothbrush or on your kitchen counter. The visual reminder can be a game changer to help you remember to take them. However, there are some important things to avoid. Don't skip doses, and definitely don't double up on your medication to make up for missed doses. This can lead to unwanted side effects or even make your condition worse. And it's essential to avoid mixing medications, especially over-the-counter ones, without first consulting your doctor. Even if it's something as simple as a pain reliever, you want to make sure there are no harmful interactions with your prescribed medications. So, the next time you're starting your day, make sure taking your medications is part of your morning routine. It's an easy step to incorporate, and it can have a lasting impact on your kidney health. Moving forward, speaking of small yet impactful habits, let's talk about another crucial step that can protect your kidneys and set a positive tone for your day: monitoring your blood pressure. It's easy to overlook, but checking your blood pressure regularly is a game changer for your kidney health. High blood pressure puts strain on the tiny blood vessels in your kidneys, damages them, and gradually reduces their ability to filter waste properly. In fact, high blood pressure is the second leading cause of kidney failure. That's why keeping your blood pressure under control is one of the best things you can do to slow the progression of kidney disease. Now, how do you check your blood pressure correctly? It's not as simple as just strapping on the cuff. First, make sure you sit calmly for about 5 minutes before measuring. This gives your body time to relax and avoids artificially raising your blood pressure from stress or physical activity. Also, keep your arm level with your heart. This is key for an accurate reading. And don't forget to take 2 readings, about a minute apart. This helps ensure the numbers are consistent. As for what you should aim for, most kidney patients should keep their blood pressure below 130/80 millimeters of mercury. This is considered an ideal range for kidney health. And remember, one important thing to note: don't measure your blood pressure right after drinking coffee, working out, or during stressful moments. These things can cause a temporary spike in your blood pressure, which will give you a misleading reading. So, take a deep breath, find a quiet spot, and check your blood pressure when you're calm and relaxed for the best results. Now, let's talk about a powerful yet often overlooked tool for improving your kidney health: practicing breathing exercises or morning mindfulness. While it may sound simple, taking just a few minutes to center yourself and manage your stress can make a huge difference, not just for your emotional health, but for your kidneys too. But how? When we're stressed, our bodies release hormones that increase blood pressure and inflammation. Over time, these factors can cause real damage to your kidneys, making it harder for them to filter waste and maintain balance in your body. So, it's crucial to find ways to reduce stress, especially in the morning when you're setting the tone for the rest of your day. One of the most effective ways to manage stress is through deep breathing. By simply taking slow, controlled breaths, you activate your body's natural relaxation response. This helps lower blood pressure and calm your nervous system, which in turn reduces the strain on your kidneys. Lower stress means lower inflammation, and that's a win for kidney health. Another great way to start your day with intention is by practicing mindfulness. Focusing on your breath or taking a moment to express gratitude can create a shift in your mindset, helping you approach the day with clarity and calmness. Mindfulness supports emotional health, improves focus, and even promotes better sleep, all of which play a vital role in managing chronic conditions like kidney disease. And the best part is that these practices are easy to implement and don't take much time. You don't need to be a meditation expert to reap the benefits. Simply sit comfortably, close your eyes, and take 5 slow breaths in through your nose and out through your mouth. If that's not your thing, try spending 2 minutes reflecting on 3 things you're grateful for. Both techniques help anchor you in the present moment, reducing the mental clutter that comes with stress. And remember, don't pressure yourself to do this perfectly. The goal isn't to become an expert meditator, it's simply to create a small space of calm in your morning. Even a few minutes of mindfulness can reduce anxiety, improve focus, and, most importantly, help protect your kidneys by lowering the stress that could otherwise cause damage. All right, let's talk about something you might not think about every day, but it's crucial for protecting your kidneys: being mindful of over-the-counter medications and supplements. We've all popped a pill for a headache, grabbed a vitamin to boost our immune system, or taken a cold remedy to feel better. But what if I told you that some of these everyday solutions might be putting your kidneys at risk without you even realizing it? Take over-the-counter pain relievers, for example. Non-steroidal anti-inflammatory drugs, like ibuprofen or naproxen. They're great for pain relief or reducing inflammation. But here's the catch: they can be tough on your kidneys, especially if you use them too often or in large doses. And I'm talking about long-term use or constant overuse. The result? You could end up doing more harm than good by unknowingly stressing your kidneys. If you've been using these meds frequently, it might be worth reassessing how much and how often you're taking them. And it doesn't stop there. Cold and flu medications? They often contain decongestants or antihistamines that can raise your blood pressure. When your blood pressure goes up, it puts extra strain on your kidneys, and that's something you definitely want to avoid. If you already have high blood pressure or kidney concerns, these meds could be doing more harm than helping. Now, let's talk about those vitamins and supplements we all swear by, mostly in the mornings. It's easy to think they're harmless, but some can actually be harmful to your kidneys. High doses of vitamin C, for example, can contribute to kidney stones. And many herbal supplements, especially the ones promoting detoxing or weight loss, may contain ingredients that aren't so kidney-friendly. So, before adding anything new to your routine, it's always a good idea to double-check with your healthcare provider to ensure it won't interfere with your kidney function or any other medications you're already taking. Now, the next morning habit for kidney patients is to monitor blood sugar. But why? This is because, as mentioned earlier, high blood sugar is one of the leading causes of kidney damage, and over time, it can damage the small blood vessels in your kidneys, reducing their ability to filter waste. The tricky part is that blood sugar levels can rise without showing obvious symptoms, and even small spikes, especially in the morning, can gradually build up and put extra strain on your kidneys. But how do you stay on top of it? Well, it starts with regular blood sugar checks. The most common way to do this is with a glucose meter, which involves a simple finger prick test. It sounds a bit intimidating, but trust me, it's quick and can give you valuable insights into how well your body is controlling its blood sugar. The best time to check your blood sugar is in the morning before you eat anything. This is known as fasting blood sugar. Why? Because this reading reflects how your body has been managing blood sugar overnight, and it gives you a baseline for your day. Now, what's a healthy blood sugar reading? Ideally, your fasting blood sugar level should fall between 80 and 130 milligrams per deciliter. If your blood sugar is consistently over 180 milligrams per deciliter after meals, it's a red flag that your blood sugar control might need some attention. You should talk to your doctor if you notice these higher readings, as they may suggest that your current treatment plan isn't quite cutting it. And here's something to keep in mind. Don't skip breakfast. It might seem like a good idea to skip a meal to lower your blood sugar, but in reality, it can have the opposite effect. Skipping breakfast can cause your blood sugar to either crash or spike, especially if you're on certain medications. It's important to keep your body energetic with a balanced meal to prevent sudden blood sugar fluctuations. And there you have it. 8 simple yet powerful morning habits for better kidney health. But wait, there's more to discover. If you want to supercharge your kidney care, check out our next video on 8 superfruits to heal your kidney health in 30 days. You won't want to miss it. And if you found this video helpful, don't forget to like, share, and subscribe to help it reach more people who need this information. Keep taking care of yourself, and I'll see you in the next video.